name is Danielle Iuliano, and I'm going to break the rules a little bit today and talk about participatory surveillance for both COVID-19 and influenza disease burden. So at the US CDC, we've partnered with Boston Children's Hospital to use data from outbreaks near me during the COVID-19 response. So I'm going to briefly describe this system. Outbreaks Near Me is a self-report system for individuals and or household members to report information on their health status for public health action. Participation in the system helps to track illnesses and outbreaks within the communities, and the system routinely collects information on symptoms, healthcare seeking behaviors, testing and diagnosis data. Demographic characteristics, geographic location, and vaccine information are also collected, and these data are generally available in real time. Many participants are account holders and long-term responders that provide longitudinal information, and the data can be summarized by demographic and geographic characteristics and syndromic case definitions, as well as time. Further, through a collaboration with Momentive, additional data on respondents are available and added to the data sets each week. So during the early COVID-19 pandemic, CDC integrated the data from Outbreaks Near Me and Momentive to monitor rates and locations of syndromic illnesses, to monitor trends and changes in healthcare seeking behaviors, and illness rates and the percent of care seeking was used to inform early burden estimation. During the middle of the COVID-19 pandemic, the data were used to better understand who is being tested and reasons for being tested, and then to describe vaccine uptake or reasons for not being vaccinated. And during the more recent period of time with the pandemic, the data are being used to understand at-home test use, reporting, and subsequent healthcare seeking behaviors, and to evaluate health equity in at-home test use. I mentioned these different ways that we looked at these data to show the value of the system throughout the pandemic in different ways it helped us to understand as shifts were occurring. So, however, no data system is without its challenges. Some of the ones identified in the system include participant retention. So during public health emergencies, there's often a high number of participants early on, but that dwindles with pandemic fatigue and other reasons for discontinuing participation. And it's often difficult to retain participants without incentives. So additionally, long-term participants may be more biased towards healthy habits and may not represent the general US population. And then there's a couple of system limitations. For example, Outbreaks Near Me is a text or web-based system, and that might limit engagements of some age or socioeconomic groups, such as children or older adults. So despite some of these challenges, we have been able to have some important uses of the data from the participatory surveillance system. Are they advancing? Or am I just talking that fast? We use the data to develop methods to estimate COVID-19 disease burden at local levels. And we explored this in certain states such as California, Minnesota, and Maryland. We also have a publication describing at-home test use in the United States. I think Autumn showed the clip of this that was published in April of 2022. The data on at-home test use is currently being used to inform CDC White House liaisons, and it's being described by health equity indicators to better understand if there's equity issues. And then our scenario modeling hub has used the data to adjust reported case counts to account for changes in case ascertainment because of increased at-home testing. So there's also many potential future uses that we are considering with these data. So we're hoping to quantify healthcare seeking behaviors for respiratory illness to inform in-season and end-of-season influenza disease burden estimation by calculating the proportion of participants with a respiratory illness that seek medical care by demographics. We're also evaluating comparing the percent positive in influenza-like illness rates from Outbreaks Near Me to our traditional surveillance system, and hoping to capture changes that could impact information in our traditional system, such as at-home test use and reporting of those results, as well as healthcare seeking behaviors after an at-home test positive. We could also hope to use these data to describe annual and booster vaccine uptake and then reasons for not vaccinating to inform models that might forecast virus activity is another way. And then finally, we have many partners that that are listed on the next slide, because this methodology is not my friend. That I just want to thank, because these data would not be possible without our collaborations with our partners at Boston Children's Hospital and Momentive.